So for a few years, I've been studying innovative models in global health in resource-limited settings. And that's led me to the observation that in health, for example, the ideal situation is that you restore health to a community and the organization itself is able to extract itself from that community. So put differently, the goal of effective health delivery is to make yourself obsolete. What's really sustainable in health delivery should be the health of the patient, not the organization that delivers the health care. Anyway, that's an idea that I developed with Alice Yang and Paul Farmer in an article we wrote a couple of years ago that came out in Global Public Health. I'm taking that idea now and I'm trying to develop it for the strategy literature. And the way I'm thinking about this situation is that I'm interested in what constitutes sustainability really. What really are we trying to achieve when we think about sustainability? In the field of health, it's the health of the population that we're serving, not necessarily the organization that delivers the health. So sustainable organization is different from actually sustainable outcomes in that example. And that sort of inspired this work that I'm pursuing now. What I'm thinking about is trying to figure out what actually is sustainable in the very long run for a community. So for example, think of effective water deployment from Canada. We have incredible water resources in this country. What's the best strategy for Canada and Canadians for managing the water supply here? And then let's think about, okay, what's the right form of organization for actually managing toward that outcome? Do we want for-profit companies? Do we want to have nonprofits, some mix of each of them, public agencies, and so on? The goal here is to think about, working in parallel between for-profit, nonprofit, and governmental bodies to try to get better outcomes than each could achieve independently. One example that's inspired me personally on this front I've been involved with is the work of Eugenzi Trust, which is a charity that I'm affiliated with. It's organized in Massachusetts and works very closely under a memo of understanding with the Massachusetts General Hospital Division of Global Health and Human Rights in the South Sudan and now in Kenya. And the two organizations, MGH and Eugenzi, work together. Each can do things the other can't do. MGH, of course, as a health delivery organization, operates by a set of principles that reflect its mandate. And Eugenzi is a charity that's able to do work that would not be appropriate for MGH, just as Eugenzi can't deliver health. Mass General Hospital can't, for example, pay the transportation fees of the patients that it sees. The two organizations working together are much, much more effective than each would be independently. And it's actually very hard to understand the effectiveness of each organization without understanding the partnership. This would be an example of two organizations that are working together to try to achieve a more sustainable and better organizational outcome than each could pursue independently. And this would be my primary interest, is to think about how sustainable outcomes for the very long run often require the support of multiple organizations under different forms that can accomplish more together than they could independently.